This video is part 5 in our educational series on how to utilize a conservative treatment approach by treating soft tissue restrictions for a client who has degenerative disc disease of the cervical spine. In the video, I cover the following: how to not be afraid as a provider to treat serious diagnosis, explaining to the client the importance of getting the soft tissue work to help slow down and then heal the disc injury, and not letting the client be defeated by the problem or play the victim. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a soft tissue injury treatment expert, specifically for chronic neck, upper back, shoulder, and arm pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of drugs, injections, or surgeries. This leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I'm also the creator of the PEAK method, where we teach overworked manual therapists a new injury treatment system that eliminates the frustrations of not getting consistent results, allowing them to reduce their treatment times by at least 50% and easily double their income. All right, let's get into the video. If you haven't watched the other 4 parts in the series, I'll link it up top here if you're watching on YouTube. If not, it'll be down in the description box wherever you're consuming that. If you haven't watched it, go and check it out because everything kind of builds up from where we go. So this week's really more about like educating and mindset and just helping the client kind of get out of their own way, because communication is really important as well. So how to not be afraid as the provider first to treat serious diagnoses. I know sometimes when you see like cervical disc degeneration, they have MRI. Some people kind of shy away from it. They're like, "Ooh, this is a little too much for me. I don't quite want to deal with that." But these people really do need your help. And just because, as I said, just because something is serious doesn't mean you need to default to another provider with more education. I see this a lot. I went to school for a very long time, got a chiropractic degree that I really don't use because I don't do any adjustments. But so much in society, people are like, "Oh, well, I'm a doctor, I'm this, I'm automatically better." But I see this more and more. Most people, it doesn't really matter what your training is. Half these people don't even have a clue as what's going on. And most people just kind of blindly try some treatment and see what happens, and they don't really know. So I see this a lot more with like the massage therapists, where they're like, "Ooh, I'm not quite sure if that's in my scope or what I'm going to do. So I'm going to refer this out to like a chiropractor or physical therapist." And honestly, they don't really have the skills to do that as well. Like physical therapists and chiropractors that are doing good quality soft tissue work, yeah, for sure. But most of the time, if you're just referring out to like a traditional chiro or a traditional PT, it's not going to help. And don't be afraid of it, because you really can help these people. Another thing, and I really want to hammer this home: soft tissue treatment is the safest and most effective approach. Might be a bold statement, but it really is. Think about the other treatments that people have that have cervical disc degeneration. They start maybe with like cortisone shot, which just makes everything worse. I talk about this all the time. Cortisone shots are bad. They're dangerous. Doctors giving them are complete garbage. Then they go a little more advanced and they do some epidurals where they really focus in there. There was a case, I think it was like 7 or 8 years ago, where all these people got this tainted epidural shot and they died. Like, that's pretty serious stuff. Then another thing they like to do is they go in and burn off nerves. Yeah, just burn the nerves off. It hurts, just burn the damn nerves off. Like, yeah, that makes a lot of sense too. Then you get into like pain pills and opioids and all sorts of stuff. And we know that problem. And then you add in surgery. And, a lot of times these surgeons just come out and they're like, "Oh, yeah, I'll just, get in there, saw some stuff away, solder some stuff here, and it'll be good to go." They never talk about the fact that you could get an infection. You could have a reaction to the anesthesia. It could actually make the problem worse, or even in some rare cases, you could die. So, you know what? What we're doing here as soft tissue providers is very safe. And from what I've seen in my 15 years of practice, it's the most effective. I've talked about this in the earlier part of this series about that book that an orthopedic surgeon wrote, basically saying, we're jumping too quick to surgery instead we should fix the soft tissue. That's us. We got a big responsibility to do it. But if we're scared of stuff and we're running away, that client's going to miss out. That patient's going to miss out. And then, you know what? They're screwed. They really are screwed when it gets into the system. And then lastly is use your damn hands. Your hands. What are you? You're a manual therapist. What does manual mean? Your hands. I am just blown away at how many people out there that claim to be manual therapists don't want to use their hands. They want to cup stuff. They want to jam some dry needles in there. They want to use all sorts of instruments. Use your hands. They're the best tool that you got. They give you the best feedback, the best precision across the board. Don't always look for all these other ways to not use your hands and wonder why you're not getting results because you suck as a manual therapist. And you know what you can do if you suck as a manual therapist? You can practice and get really good. And you know what? You're going to help a lot of people. Yeah, that need your help. A little ranty there, but come on. You're a manual therapist. Let's get it right and let's use our damn hands. Next, explaining to the client the importance of getting the soft tissue work to help slow down first and then heal the disc injury. Education and proper communication, in my mind, is just as important as the treatment. You know, your job as a provider is to get them to understand what's going on, what you're doing to help, how they can stop doing dumb things in between to continue to have this problem be worse. So a lot of providers, they don't do this. They just kind of treat and they go, all right, yeah, go do your thing and figure it out. And then we'll go from there. You know, the client is coming to you because you have a unique set of skills that can actually help solve their problem. So if you're just kind of winging it, and you don't really know, and you're not telling them what's going on, like, no wonder they're not getting any better. So many people like shy away from these conversations. I always say, you know, really be the provider that tells the client what they need to hear instead of what they want to hear. Yeah. And don't let them run the show because you know how that goes. Next is just letting them understand the cause versus the effect. So in these situations, a lot of times when I talked about is a lot of these disc injuries that I see in my practice, especially with chronic pain, people don't have a direct trauma or accident. So clients are like, how the hell did I get degenerative disc disease? And they really, a lot of providers, especially in the traditional medical model, they really want to address the disc, what they see on MRI, what they're seeing for pain. That's the effect. We, the people that are soft tissue providers that are using our hands, as I said earlier, we're the ones that get to the actual cause, the cause. It's really important. What caused it was the buildup of all the soft tissue around there. And that's what we do and explain to the client, hey, we got to get this because this is what's actually causing it. And it's hard for clients to understand that. They're like, well, it hurts here. Why aren't you fixing here? I'm like, well, all this other stuff happened. That's where the communication and education comes in. Because clients are going to be like, what are you doing? Or they might watch some jackwagon on Instagram, tell them what's wrong with their problem, how to fix their injury. We're like, if that's working, then do we have a pain pill epidemic? Why are so many people in pain? And why are we wasting so much money on musculoskeletal stuff? Because we're missing the key component, which is the soft tissue. Next is I explain to the client, your disc is like your thumb and it is stuck inside a car door. The car door is all of that bad tissue around there. We cannot give your thumb a chance to heal up until we remove this. And then so they're like, well, they recommended surgery. I'm like, yeah, cool. They recommended surgery, but your thumb's in there. It's like they pull it out of the car door and then the car door slams right back down. That's why you have things like failed surgery diagnosis codes because they're not getting to the root cause. They're only treating the effects. And they wonder why people aren't getting any better. Lastly, and I think this is so important, is not letting the client be defeated by the problem or play the victim. Just because it says disease in the diagnosis does not mean you, the client, are helpless and at the whim of the medical system. You know, I'll have clients come in, they're like, well, I got degenerative disc disease. There's nothing you can do for me. I'm just going to be on pain pills the rest of my life, pain management. This is how it's going to be. It's like, okay, you know, is that how you want to be? Cool. But, you know, that's not how it works. And they think that they have to go to the orthopedic doctor. They have to get the injections. They have to do that because that's what insurance pays for and all that. Like, it's a big freaking racket and a big scam. Next is just victim mindset in society. I'm not going to get too ranty on this, but basically, you know, everyone wants to be a special snowflake and have some type of disease or some reason why they can't do it. They're like, oh, you know, I'd really like to play with my kids or play with my grandkids or do this, but I have degenerative disc disease. That's just who I am. It becomes their identity. It becomes who they are. And it really just makes them kind of, I don't know what it is, like nihilistic, very cynical. And they're just like, this is how it has to be. And no one can help me. And they don't want to be helped because then they actually have to like do the things they say they want to do. I've had so many clients come in where I'm like, hey, what do you want to be able to do? And they're like, I'd love to do this, this, and this. And then we get them better. I'm like, all right, now you can do that. They're like, oh, I don't really want to do that. I just wanted to complain and have an excuse for why I can't do things in life. Next is just this idea of like limiting beliefs where they're like, I'm just stuck where I am. Great book. I think it's called Mindset by Carol Dweck. And she really talks about there's two types of mindset, the fixed versus the growth mindset. You know, the fixed is like, doesn't matter. I got lousy genes. My dad had a bad neck. My mom had a bad neck. I'm going to have a bad neck. It's just how it is. Growth mindset is where you're like, yeah, I got dealt a lousy hand, but I'm still going to do something about it. And your job is really to help them become more of a growth mindset person, just not let them sink in deeper and deeper to like the depression of being in chronic pain, and let them know, hey, I'm going to help you, but like this is a battle and we're going to get it done. We're going to get it done the right way, but we're all going to be involved in it. And the last one, I think this is so important, is passive versus active role for the client. We live in a society of instant gratification. People want stuff right now. They fall for a lot of tricks, like things like stem cells and injections or surgeries, because in their mind, it doesn't really require any effort or sacrifice. But we all know that there's no magic fix to things. And a lot of times clients come in and they're like, here's my problem. You fix it. Here's the fire I started. You know, and the big thing for you is changing your mindset as the provider and being like, I'm here to help, but I'm not going to carry you up the mountain. I'm going to show you and guide you along the way, but they have to be more active in the process than you do. I always say this, and my mentor taught me this early in my career. He said, you know, you can't want the result more than the client does. So the client has to be bought in, and they have to do things to help in between treatment. Because, you know, maybe you're seeing them for one treatment a week. I see my clients for 2 treatments a week in the beginning, but there's still the rest of their life and what they're doing. So that's where that education and communication comes in. And it's really, really important. That's why I made a whole video, this whole series about this, because it's so important, especially when you're dealing with people in chronic pain, just stuck in that negative mindset of like, I just got degenerative disc disease, nothing can be done. So I got in the video. Appreciate you watching. Feel free to share any insights you might have gotten in the comment sections below. I try my best to answer any questions I get in there, and, you know, try to just share more information. I think we're better when we all share information together. Next is if you like the video and it helped you, share it with some other providers that, might help as well, do me a solid. And lastly, you can go in and download our free training modules, where basically we go through the whole system of neck, shoulder, upper back, and arm pain, from start to finish, what questions to ask, what tests to do, what treatments to do, client communication, education, everything to really help you get that reputation in your area as more of a solutions provider versus a service provider. I appreciate you watching the video, and I'll catch you on the next one. Bye.